Fiedler?
Wow.
Okay.
It looks sorry, gentlemen. Very sorry. I'm late. Ooh.
It doesn't matter.
Oh, well.
Anyhow,
much easier navigating a vessel, I imagine.
So all of us are very happy that you finally have been able to join. I already made a very short introduction about yourself, your career, what your position is, and what your incredibly experience is. And I've just started to talk a little about a case we just recently had, where a captain called us on the urgent call numbers, on our urgent call number, and that leads me immediately to you, Mr. Fiedler.
Yeah.
Would you be so kind to tell us something about what is when it comes to medical cases on board, not necessarily to the utmost urgent or dramatic ones.
Yeah.
What is the current status? What are the feelings, the experience, and the perceptions of a captain on board a commercial vessel when it comes to medical cases?
Well, we have to make the difference, of course, about a normal sickness, which is quite easy to handle. Okay, if it's an acute appendix or whatever and so on, then we come in trouble as well. So once I had to give a bladder catheter to my chief engineer. I can handle as well because I have time. I can read a little bit in the book. But the most important thing, and then when really panic occurs, is accident. And we had terrible accidents on board. You know what can happen on board, and what can happen, it will happen sooner or later. I made some really bad experience. Luckily, I've been always pretty close to shore, and once in a time I've been just deviating to Malta, and the doctor came within 2-3 hours and so on. But if something's happening in the middle of the Pacific Ocean, Atlantic Ocean, any shore is about a week or 1.5 away, then we are in a deep shit. Let's say somebody has a real bad accident, the blood is bleeding around, and everybody is roaming around and so on and so on. So we are in panic. There's no doubt. We are no specialists and so on. And just in this moment, I would feel really, really happy to have a specialist on a let's say in a video meeting or whatever. I can show him, oh, this is how it looks and so on. Please advise. This so far is not possible on our ship nowadays. Not yet. We had a couple of years ago. We had somebody from the Charité in Berlin on board for a test run and so on. But I never heard something about what's the outcome of the whole story. But anyway, this would be the most important thing what we require. Anyway, in this moment, we have a real bad accident. We are in panic and excessive demand of myself and my officers. And another point is we are not educated at all. We have this kind of courses, of course, in the hospital. Every 5 years is a repeatment of that. And everything is theoretical, and nobody sees blood, and nobody is nearly able to handle a case like that. In this moment, to have somebody on the other end of the line, far away in Hamburg, Berlin, or whoever, then it would help us a lot. So far, I made good experience with the MRCCs, with the different MRCCs. Mostly they have doctors in the background and so on. And I had recently 2 cases with that, and they made a pretty good job. So we are, on our shipping company, we are mostly connected with this Cuxhaven hospital, which is, I don't know sometimes who's on the other end of the line. I think it's an arts and practicum or practical guy, you know. But I have never the feeling that I have a specialist like a cardiologist or a urologist or whatever I need in this moment. Well, this is so far what I can say. But anyway, on board, in a real case, there's panic. There's no doubt. Yeah.
Yeah, thank you very much, Mr. Fiedler. Honestly spoken, having spent more than 20 years in emergency medicine in hospitals, I have a lot of, I admire a lot the bravery of captains on board commercial vessels who are responsible for the first aid and for the handling of medical cases. And but from what you've told me, I hear 2 major columns. The one is indeed the immediate online advice, how to deal with, and
Absolutely.
I hope you will forgive me if I call it to somebody to hold your hand or to guide your hand. And the second is,
come to the point.
And the second is indeed the entire bundle of, let's say, ongoing education with regards to one minor topics of your responsibility. Indeed, your main focus of your job is a completely different one. So it is always considered, let's say, some kind of side effect you have to cope with. But the question is, how can both columns be brought to a higher level that you on board the vessel first are not as scared as much, so we can avoid panic, and secondly have, let's say, the best possible outcome in that given circumstances to your crew member.
Yeah.
And thirdly, and allow me to move over to Björn, that immediately has a tremendous impact on the ship's operations. So for the ship management companies or the ship owners in total, more or less every medical case has a relevance. Indeed, it is just a code that is, sorry to say, some peanuts, but the moment it potentially impacts the ship operations, there is not only when we talk about loss of time and fees, but there is a bundle of potential consequences from crewing, from the delivery of the deliveries, from port fees and so forth. So Björn, let me ask you, from the ship managers, ship owners' perspective, where are the pain points or the key interests when we look at how to adjust medical care from the Medivian level to a level what we all perceive as normal and common medical care short?
First of all, thank you, Jens, for inviting me, and very pleased to be here. And I think it's a highly relevant topic. And as you said, I have a little bit of background in shipping. I started very early on during my childhood days, I would say, on a small coastal day cruiser in the Baltic Sea, and then was on the first container ship at the age of 15. And have been sailing for a couple of years, and then have been working in various ship management functions as well. And of course, I still have this seafaring background from my times on board, and have been in charge of looking after colleagues who had medical issues as well. I must admit that being a doctor is not necessarily my core competence, and that's why I quickly went to other things, obviously. However, but to put it a bit in context, I mean, V Group, we look in a totality after some 1,000 ships, right? So which is a large fleet, globally run, all kinds of vessel types, large tanker fleet, multiple risks exposed to. And of course, my role, or I would consider, since well-being and health of the people is very much at my heart, my biggest role is to make sure that the seafarers return home safely and well. And that, of course, involves prevention on the one hand. So a lot of things have to do with prevention. But on the other hand, also dealing with incidents, accidents, or medical conditions on board. When we look at the prevention side of things, of course, a good medical care from our side helps us to make sure that we set the right quality standards, that we set the right consistent standards that our seafarers get checked upon, so that we give them peace of mind, and of course also us peace of mind that they are healthy and can perform their contract safely and in a controlled way. This does not exclude if there are medical preconditions. I think people have those, and it's a reality we face today. But if it's in a controlled environment, I believe it's all manageable. So prevention is very, very important from a medical perspective, but of course also from a safety perspective. So when we talk about medical care on board, it goes hand in hand with occupational health and safety. taking charge of each other, taking care of each other, and all the things that we have been talking about in the industry for many years. And so how do we create a culture on board that people act safely and have a confidence and comfort to speak up if there are unsafe acts and conditions? Because this is really the most important thing, is to prevent things. And sometimes it's small carelessness that can result in quite big things. And we all know this from our private lives. When we have a moment of inattention or inattention to a certain condition at our homes, and then we have a small accident at home, and then we have, of course, the luxury of being able to go to a doctor next door. We may wait a few hours, but we get the service that we need. And that leads me to the second thing beyond prevention, is really that there is a reliable team of experienced physicians and other doctors, experts, specialists in their area that can support our crew in such cases. And Captain Fiedler mentioned that. I think when you have a medical situation on board, for us, it's very important. Time is of essence there. We never know what is really going on. We are not medical experts on board. And we need to know what is the condition as fast as we can and as good as we can. And certainly technology can help us a little bit today, but it is a very uncomfortable situation when you have an event on board or a medical condition on board that you're not fully aware of and you don't know what to do. Having been a seafarer, as I said, we love to follow cooking books and recipes, right? And we are trained like this, so we follow our checklists and all of this, but it's probably like cooking a meal. It's not always right what you get as a result. At least my cooking skills are a little bit inferior to some others probably. So if you're not really a doctor, you can't provide the best service to and the best care to a crew member. But if you have someone supporting you, like you may have someone at home or you attend a course or something, you upskill over time, but you also get more comfortable in dealing with smaller things and bigger things. So that's when it comes to the people. Of course, if we look at our larger scale of operations, there's a lot of regulatory health issues that we have to deal with. They're ever changing, and we need to make sure that we are always updated and that we stay updated, that we don't miss out on anything. And I think it's something that we owe to our community, but also really to our seafarers here. Then very recently, of course, with a fleet of that size that is trading globally, I don't want to spin the whole discussion into COVID, but of course, whatever has to do with infectious diseases, and this can be dengue, it can be other stuff. I'm sitting in a rented office today, which has a very fancy name. It's called Malaria, this conference room, for whatever reason that is. But things like that are also happening on board, and we need to make sure that we get the support to identify and to really get understand the symptoms and rule out certain things and provide fast and quick response. So really the whole crisis management and emergencies and all of that. As I said, when we are at home, we can quickly go to a physician if it's a small thing, or we can go to an A&E and get the care that we really think we should have. And sometimes we overreact, but better check if in doubt. And particularly on board, you don't want to have someone that is really there for a while. And of course, if you put that into context of what is happening at the moment, this has become way more difficult nowadays because people are scared of taking seafarers ashore, even if they may have a fever from something that is totally unrelated to corona situations. We have serious challenges to get sometimes people off the ships with partially irrational behaviors of port authorities, and that's something which you might argue in our size. This comes straight to my desk, and then we try to find ways around that. But during that period, when we have to clarify matters, we need the support from experts that make sure and give us the guidance how to deal with this. So in an essence, it's really looking well after the people on board, making sure they return home safely. But in the end, this, of course, is a precondition to operate any ship safely, that the crew is healthy. If you have a healthy crew, you can work safely, and the ship will also do a good commercial service ultimately. That probably summarizes a little bit on what my expectations are. And going forward, I hope that technology, sensors, whatever we can use, can help us a little bit. Maybe as a last anecdote to that, We are all used to iPhones or whatever. I don't make a lot of marketing for Apple, but if you have a broken foot or something, the iPhone will know before you know, probably, because it measures the way how you step, etc., etc. So there are certain things that we can probably apply on board in the future that help us to do diagnosis a little bit better.
Thanks a lot, Björn. What I've taken is, the first one is prevention, and that reminds me, I don't know, have you heard about the Swiss cheese model?
Of course.
Exactly, and it is to tighten the holes in the cheese up down to a minimum by wellness programs, by proper PME quality, by procedure and education and training, as Captain Fiedler has already mentioned. And as you have mentioned last, the iPhone, that indeed leads immediately to let's say, to the digitalization, and for a very good reason, we have called it a digital day. And I'm really proud that we as MMS have been allowed, however you want to phrase it, to build up a very strong partnership with Triton Software, which is Andrew, the president and CEO of, and Triton Software actually provides us with C-Care, which is the #1 of IT platforms worldwide to the shipping industry, with various tools. So, Andrew, when we come to the points we have been just mentioned, the prevention, the PME, the online guidance via video, the process and procedures, and immediately followed by documentation and transparency.
Sure.
So what are the benefits of a platform like yours? And let me ask, what is the vision from the IT perspective, where to move it, that, let's say, finally, all of us collectively come to a level that we really, let's say, at least get close to MLC, where it is required that the seafarer may be able to achieve the same level of medical care compared to a shoreside worker.
Sure. No, first of all, again, thanks for having me, Dr. Tolson. It's a pleasure to be on here with Bjorn and Captain Fiedler. So it's really interesting to hear the gentleman talk, because they touch upon certain things that we see. And you have certain companies like B Group who are very much ahead and very, very much forward thinking in terms of how they need to address the medical aspects on board. But generally speaking, the vast majority of the industry isn't quite there yet. So a lot of the obstacles that have been created, a lot of them are around technical obstacles. So it's very difficult to get technology to work on these vessels. They don't have good infrastructure. They don't have good connectivity. So you need the right type of technology that uses low bandwidth, is easy to get up and running, and then connect the entire fleet and have the ability to actually access quality medical care. If you don't have the ability to access it, it makes it quite a challenge. So if you look at, we would never ask a captain to navigate a vessel or a chief engineer to understand what's wrong with a vessel without the proper tools. Right? It's the same is true for a medical practitioner trying to understand what's happening on a ship. Trying to do that via email, which is obviously not compliant, and various other things, it makes it quite a challenge. So our whole objective between those two relationships is to help enable what a medical practitioner can bring to help solve a problem on board, and give them all the tools, just as you would as a captain, navigational tools and so on, to be able to diagnose and understand what's going on with your vessel. We want the same to be able to understand what's going on with the crew. Really interesting what Bjorn had mentioned. He's absolutely right. It's not just about crisis management and having something that happens on a point in time and a physician you can call when an accident happens. It's a much broader picture than that. So there's plenty of technology that can bring a video. What we try to do is bring a platform that can sustain and support all the way from the point of pre-employment medical exams. So understanding, as Bjorn said, you will have crew that they will have pre-existing conditions, and there's sometimes they're acceptable and there's no way around that. So the question is, how do you manage that? And then you have, quite frankly, healthy people, and those healthy people sometimes have problems. So you need the proper programs and the proper prevention to be able to manage that. Certainly to do that all off of a binder or paper or out of somebody's head is very difficult and challenging to do. So we bring a technology that takes it from the point of employment all the way through operation. As long as they're employed, if they have to get referred shoreside or medically disembark, the whole entire process gets tracked. And then we utilize tools that allow a ship owner operator to be able to manage and have visibility on everything that's occurring within their fleet. So the idea is if you have a problem area or if you're hiring a certain way, then you have the ability to understand how can I prevent that from happening at the individual level, but also at a population level. When you look at the almost 2 million seafarers, I believe that seafarers are one of the largest underserved populations in healthcare. And it's not by fault of anybody, only because of just it's very difficult to get access and technology hasn't been able to get out to these vessels. So a lot of that's changed. So you have a couple of things that have changed. Now, this is a technology we specialize in. So low bandwidth, the ability to get video, the ability to connect with devices and give a total picture, and have a complete platform that can address every aspect of care. But we're also seeing that it's impacting cost. So there's a study, Dr. Toolsma, that the International Maritime Health Journal did. It said on average, 1 in 5 vessels gets deviation for medical reasons. And they anticipated that somewhere between 30 and 50% of those were preventable. Well, that has a direct impact on cost. And as Bjorn mentioned before, with prevention, if you can do prevention and avoid diversions, there's a business case for it, which typically gets everybody's attention. The other thing is, we hate to talk so much about COVID, but the reality is COVID has done a lot to get people to be able to embrace the means and the methods that we're doing today, which is virtually connecting with somebody else. And it's brought that across all demographics. So you have much more receptivity to being able to have these types of technologies, be able to connect from that perspective. So I think the timing is right. I think it's been talked about for many years in the industry, but I see, you have the companies like V Group where they're taking the lead. Things are changing. There's a different level of awareness. You mentioned compliance. GDPR came about. Different sections of the world have different levels of compliance around medical information. So HIPAA. We rarely talk about one of the largest threats to the maritime industry, and that's cybersecurity. So you have these systems that are older or archaic that exist on these vessels that are incredible threats to these organizations. So getting in technology like this, putting it in place, you're helping enhance your cybersecurity posture as an organization. So altogether, I think if I had to summarize, I think you're going to get a lot more connectivity. It's going to be more integrated tech between the operations, the devices, the services. You have more visibility into what's occurring on these vessels. And at the end of the day, the seafarers will have that assurance that should something happen or when something happens, that they'll be properly taken care of. So I think over the next 5 years, it'll almost be necessary. It's not irresponsible to not have something in place, because it's just a thing that is long overdue and needed in the industry. So we're hoping to play a big part of that.
Yeah, thank you very much. Unfortunately, we have promised to our audience short and crispy sessions. So finally, half an hour is gone. So I thank you very, very much for your participation, for your contribution and input. I think that has been incredibly valuable, because even in this in this very short time, I hope we have been able to draft a picture what, from all of our perspectives, and I perceive that we are very much in alignment and agreement, the current status of medical care for our seafarers should look like. And just as a final remark, as we all have avoided to talk about COVID, what currently comes up to me is really, and I've just published it, is a breach of ethical principles. What we all experience against seafarers, that even disembarkation is denied in urgent cases, is talking about the baddest, about the worst in all of us. And I think it should be one of our part of contribution to do the best to our seafarers and to keep them healthy, to employ them healthy, or to help them to get healthy again as quick as possible. Thank you very, very much. And to the audience, as said in this morning session already, we have registered all your questions in the first session already. And if you have entered some of the Q&A sector, now all your questions will be answered in the following session in roughly 1 hour. I thank you for your participation. I hope you enjoyed it. And again, my biggest gratefulness to all the panelists. Have a nice day. Thank you very much.
Thank you.
Thank you.
It was a pleasure. Bye-bye.
Goodbye.